nowadays we are hearing a lot about diabetes, and India is becoming a diabetic. Of all the countries, India, we have a lot of patients with diabetes, and especially Bangaloreans. This is called World Diabetic Capital ಅಂತ ಹೇಳ್ತೀವಿ. And this is going to cause a huge health problems for women also, especially women of childbearing age group. When they get into diabetes, let's see what are the complications they have if it is not tested properly and not treated properly. Majority of the patients, any woman, when they become pregnant, it is a compulsory for them to go to their doctor and get themselves checked. So regular checkups sometimes may pick up diabetes or no, or sugar intolerance or no. There is a special test called glucose challenge test, where we give 75 grams of glucose and test them after 2 hours to see how much is their sugar values. Why it is important? Because this, if it is detected early, we can prevent future complications. What are the complications it may cause a woman who is carrying, is having pregnancy? Like maternal complications, maybe they may be predisposed for future diabetes. They may go for high BP. There will be maternal excess weight. So maternal complications, as I was telling you, it causes high BP, then excess weight gain. They will have multiple prone for infections, and in early pregnancy they'll have repeated miscarriages, repeated abortions, and as a pregnancy getting in the second trimester, we call it as, their second trimester and third trimester also, they'll get multiple complications like excess water accumulation inside, called polyhydramnias, and congenital abnormalities. The baby who is going to be born with a woman who is not controlled their sugars properly, they will have high chances of going for congenital anomalies. And if it is left untreated, the woman during birth also, they will have, the baby will have excess weight gain, macrosomia we call it as in medical terms. During birth also they will have birth defects like shoulder dystocia. So, and they are more prone for operative deliveries. And for the baby also, baby will have lot of complications even after delivery, that they'll have macrosomia, excess of fat in their body. And any child which is born to a mother whose sugars are not controlled, then they have future, if the baby is exposed to high maternal sugar, high glucose in the mother's body, if those type of babies in future, they'll develop into diabetes. So our aim as a gynecologist is to make the next future generation diabetic free. That starts from the gynecologist. The role of the gynecologist is very important in this era of high diabetic population in our country, because we can prevent it. So we can prevent the future generation. So many of the women are unaware that they are diabetic also when they are pregnant, because they feel that it is a family history and their parents will have, or their parents don't have also. They feel that they are healthy unless it is checked with the doctor with the oral glucose challenge test, which I have been telling you, with 2 hours of blood sugar test after 75 grams of glucose, which is highly recommended by all gynecologists throughout the world. Especially in India, it is suited for our Indian population. That can prevent complications, and that can prevent further problems in the future generation.